Do this one thing to relieve prolapse symptoms naturally. Hi, welcome to our Ed Talks, little snippets of education to help you heal and feel empowered. I'm Justine Calderwood, pelvic floor physical therapist and certified birth healing practitioner. Welcome. Today we're going to talk about one thing that you can do at home to help your pelvic organ prolapse symptoms. So if you landed on this video, you probably already know what pelvic organ prolapse is. So we're not going to dive into all the ins and outs of that. But what I'm going to teach you today is diaphragmatic breathing and ways to help yourself be successful with that. So first we're going to talk about what is diaphragmatic breathing, what's the diaphragm, and why does that have anything to do with pelvic organ prolapse. First, I want to show you this illustration, it just shows you the inner core muscles. So if we're looking at this from the side, you can see this person, their spine is here and their front abdominal wall is facing this direction. Well, you can see this diaphragm muscle is a dome-shaped muscle right underneath the rib cage. And then we have underneath here, we have another dome-shaped muscle. It's kind of like a bowl. It's the pelvic floor muscles. That's the top and the bottom of the core. Most people, when they hear the word core, they think it's just their abdominal muscles. Now, the core does include the abdominal muscles. The inner core abdominal muscles are the transverse abdominis. They go across or transversely here, and they wrap around and attach onto the thick connective tissue of the back. And then we have little muscles called the multifidi muscles that go in between the vertebrae of the back. So if we look at the core as being kind of a canister all the way around, it's not just your abdominal muscles from the front. We have that, again, the dome-shaped muscle, the diaphragm up here, pelvic floor muscles, which support the pelvic organs underneath, the transverse muscles, transverse abdominis muscles, and then the multifidi muscles. So when it comes to something like pelvic organ prolapse, we want to make sure that we're managing the pressure into this canister so that we're not just doing a lot of belly breathing or bearing down, which can put pressure into the pelvic organs and cause symptoms of prolapse, such as pelvic heaviness, feelings of bulging, even pelvic pain or fullness, and it might lead to symptoms related to the bowel or bladder function, inability to empty your bladder or your bowels adequately, or even some leaking. Today, what I want to teach you is how to breathe with your diaphragm. Again, instead of just doing belly breathing, which a lot of people do naturally, or breathing with the upper body, like up the chest, we really want this diaphragm to be moving, and that comes from movement of the rib cage. I'm going to have you imagine with this little rib cage model that I have that the dome-shaped diaphragm sits underneath here. If you can imagine as you inhale, we really want the rib cage to expand out because your lungs sit up into here. So we want that breath to come down to fill the lungs and get the rib cage to expand out. The diaphragm, in turn, with that inhale, actually kind of flattens out, if you can imagine that. It flattens out with the inhale, and then when you go to exhale, this is going to come back together. The rib cage comes together, and the diaphragm is going to move back up. Okay? So remember, that's the top of the core, the inner core muscles. So today what I want to show you is how to get some movement here in the diaphragm and the rib cage and start to breathe properly. So again, we're not just putting a lot of pressure downward into the pelvic organs and causing some symptoms. I'm going to show you some tricks that I use with our patients here at the Healing Spot, as well as students of our online Fit to Be classes, on how to breathe with the diaphragm and be successful with that. The first step is just using your hands in order to help your brain connect with that part of your body. So I'm going to go ahead and just bring up my shirt here. I do have a sports bra on. What I'm going to have you do is just take your hands right along the rib cage, almost like you're making a little C, and I want you to use your hands to press in kind of like this, okay? And it's going to help your brain connect in with that part of your body. So I want you to inhale through your nose and see if you can get that rib cage to move all the way around and out into your hands, and then you can exhale out through your mouth. Okay, so try that again. Inhale through your nose. Hold it a little bit at the top and exhale out through your mouth. As you're exhaling, blow out like you're blowing out through a straw. That will keep the air in your lungs a little longer and allow some mobility through there. I'm going to show you this from the side. Okay, so as I'm inhaling, I want you to see in between the ribs here some movement. See if you can see it opening up. There's little muscles called the intercostal muscles in between the rib cage that should be working to get the rib cage to open up. Okay, so here we go. And then you're just going to exhale out. Try that again. And exhale out. So starting out, I like to work on things that we call proprioception, meaning we're trying to get the brain to connect in with this part of your body. This might feel kind of foreign to you, like you haven't done this ever before. So you can use things like your hands to help connect in. I like to even use a mirror in front of me and with patients and students in order to help them see the movement of the rib cage. It just gives the brain a little bit more feedback and input. You can also use something like a TheraBand. I prefer a TheraBand that's nice and flat versus a cord, but you can take this, place it around your rib cage here, and pull it a little tight, not super tight. And then you don't want to knot it. You will not get it undone, but if you just want to tie it in a little bow here, this now gives you that sensation all the way around for your brain to connect in with, and see if you can get that expansion almost like an umbrella opening up and out. Okay, so that's my first tip on learning diaphragmatic breathing. The next tip I'm going to show you is a way to improve mobility. So if you feel a little tight into this area, then this tip is really going to help you out in order to get better mobility, because I find sometimes people have problems with being able to connect with that part of their body, more of on the proprioception level, like I said. This is more for if you feel tight, like I can get the breathing, but it just feels like it doesn't move much. So with this tip, you're going to need a soft ball. You could try to use a tennis ball or something a little firmer. However, I do prefer a soft, almost like playground ball, about 4 inches in diameter. What I'm going to do is I'm going to take this ball and I'm going to place it right along the bottom of my rib cage, right in the middle. Okay, and then I'm going to lie down on top of it. So this is why you're going to find a soft ball feels a little bit better than a very firm ball like a tennis ball. So now you can see how this is creating a little bit of pressure upwards into my lower rib cage and right along my spine. And hopefully you can see how my rib cage kind of opens up here. I'm going to keep my back down, but I'm allowing this to open up. And then I can combine using my hands and doing some breathing. But what the ball is doing is allowing a myofascial release into my rib cage and my spine where the rib cage meets up in the back. So you can do something just as simple as this, maybe palms facing up towards the ceiling, and just work on some breathing. And you don't want to get in a hurry here. You can spend 3 to 5 minutes breathing. Again, use your hands if you need to, if that helps. Now I'm going to expand on this tip because I really feel like this next part of it makes this even better. So keeping the ball where it's at, what you can do now is take your hands right along the front of your sternum and rib cage, and you can do a little self massage. I'm going to sit up here in just a moment so you can see what I'm doing, but I'm bringing my fingertips right in underneath my sternum, and I can glide right along the angle of the ribs. And it's like I'm trying to bring my fingertips up underneath the rib angle here. So you want to be gentle with this, but I'm going to kind of show you. I'm coming in and under. You might, like when you're lying on your back, you're going to be able to feel up underneath there, but I'm going to have to lean forward a little bit because I'm sitting. But I could do this both hands at the same time, and it's like I'm trying to come up right along here and down towards the side and bottom. You could even try both hands on one side, really getting in there. See if you can get the border of your fingers there up underneath the rib angle, and then I can move to the other side. So I'm gliding. You could also just even walk the fingers and spend a little bit of time trying to get the fingers up underneath that rib cage. Be careful, because here on the right side you do have your liver, and on the left side you have your stomach. So just be careful that you're not jabbing in there really aggressively. My last tip today is to learn a training system called low pressure fitness or hypopressives. It's my preferred method of teaching to get strength and function and mobility back into the inner core for prolapse management. I'm going to show you what it looks like here in just a moment. This is something that we do teach online in our online Fit to Be classes, and I will definitely give you the information to check that out in the link below. What I'm going to do is show you real quick just a demonstration on what hypopressive exercises look like, or low pressure fitness. So I want you to pay attention to what's going on here at my rib cage, and you're going to see this lifting in and up when I do the hypopressive breath. It's also called an abdominal vacuum. So here I'm going to inhale in. I'm going to exhale out. I'm going to hold my breath and do the hypopressive. And then I inhale and it fills back in. So that's a really quick demonstration of what a hypopressive breath looks like. But what we do is we focus on the rib cage opening. And since we have exhaled the air out of our canister or our core, what happens when we do that opening of the rib cage is everything underneath gets suctioned in and lifts up. It's a really great way to lift up the pelvic organs and to get strengthening of the pelvic floor muscles, as well as the transverse abdominis muscles from the front, the multifidi muscles from the back, and of course we're using the diaphragm with that. So like I said, it's my preferred method to teach women with prolapse how to manage the pressure into their abdomen, into their core, and how to work on getting strength and function back so that they're not having symptoms of prolapse. If you have specific questions regarding pelvic organ prolapse and you would like some guidance, I would recommend head to our website, healingspotphysicaltherapy.com, and pick whatever option is the best for you. I recommend request a discovery session with a member of our therapy team, and we can get any of your questions answered and explain how we can help you with an individualized plan to help you feel more confident and relieve your symptoms of prolapse. I also urge you, while you're on our website, to check out our Fit to Be online classes. It's a great way to connect with us online, no matter where you live, and get some guidance from myself as a pelvic floor physical therapist, and learn how you can do the hypopressive breathing and the low pressure fitness in order to manage your pelvic floor symptoms. Thanks for watching this Ed Talk. I'll see you on the next one.